Hi, it's Jenny D, and we are doing Health Tidbits with Dr. Kohli, of course, the 9 News medical expert. You've probably seen her there. She has a practice, Cherry Creek Heart in Aurora, and always accepting new patients as well. We appreciate you when you come by. And what a big week it has been. The first case of measles found in Pueblo in Colorado. So, like walk us through basically what the symptoms are of measles first.
So, Jenny, we thought we had eradicated measles, right? Because the vaccination is so effective. 2 doses protect you 97%. But with less and less people getting the vaccine now, we're seeing all these cases pop up. So it's a virus that causes a very severe infection. You're talking fevers to like 104, 105. A cough, conjunctivitis, and then you get this very characteristic rash that starts behind your ear, spreads to your face, and kind of down your body. Now, if it was just that, it would be okay, but it can actually, 1 out of 5 people that are unvaccinated with measles can end up in the hospital because it can cause encephalitis, which is brain swelling. It can cause blindness. It can cause deafness. It can cause death. So it's one of those infections that's really very severe.
Oh, my goodness.
Yeah.
So why is it so contagious? Like, basically, how do we stop the outbreak?
Yeah, so scientifically, it's a very sophisticated virus. So it does a few things to trick us. The first is that it is airborne. So that means if I had measles, I coughed into a room and then left, the virus particles would linger in the air for up to 2 hours afterwards. So you could actually contract the infection without ever coming into direct contact with me.
Oh, wow.
The second is that the virus itself is very contagious. So usually we look at something called R naught, which is if one person has it, how many people on average are they going to infect? And for measles, it's 12 to 18 people that would get infected by every person that has it. So it multiplies and spreads very rapidly. We talked about these immunity gaps, and you can actually be contagious before you're having symptoms and for a long period afterwards. Even after you've had the fever, you're still contagious. So all of that put together, combined with the fact that we don't have any treatments or, any ways to really get rid of it faster, makes it spread quickly. Now, prevention is key here because the vaccine is so effective that if you have the vaccine, you have what's called lifelong immunity, which means that you're never going to need to worry about the measles, really, because it's 97% effective. Now, if you're born before 1957, you probably have natural immunity because we didn't have a measles vaccine then, and it's so contagious, so you caught it. But after that, you really want to think about whether or not you're protected with checking your blood tests and your titers.
Wow. I mean, that, and it's in it, like you said, like we were like, this is an old disease. Like, I know, like that sounds pretty rude, but it's like, this is an old disease.
Why I've never seen a case of it.
Really?
In medical school, I never trained because it was eradicated when I went to medical school at Harvard. And so I'm sort of having to learn how to treat this new disease. It's an old disease, but it's a new disease.
So even if you do come into contact and you have your vaccine, there is a slight chance that you can get it and contract it.
Exactly.
So making sure you're paying attention to all of those.
And looking at that time period. So it's really 1 to 3 weeks after the exposure. So if you were in Pueblo at that cafe or that, clinic where the CDPHE is saying that there was increased exposure, you want to watch yourself for about 3 weeks afterwards from that contact to see if you develop any symptoms.
And did they say how he got?
Yeah, so he was unvaccinated and he went to Mexico where they were having an outbreak. So I always like to say measles anywhere is measles everywhere. Yeah, and we kept saying all this time, it's not in our state, it's just in Texas, it's in Mexico, it's in other countries. But really, of course, it's going to get on a plane and come here just like we saw with the COVID.
Yeah, and now you think like everybody that was on that plane and everybody,
Right.
And that's the scary part about some of these diseases is how quickly it can spread.
Right.
And this, it's very preventable.
It's very preventable. And there's some people sadly out there who can't get the vaccine. So if you're immunocompromised, because it's a live vaccine. So they actually weaken the virus, but it's a live form of the virus. So if you're immunocompromised, your immune system's turned off, you can't get that vaccine because it'll actually give you the infection. Pregnant women can't get it as well. Kids under 1, right? They're too young. My brother actually had measles when he was 7 months old in India, and he had 2 seizures from it because his fever got so high and because he hadn't yet been eligible for the vaccine because he's too young. So it really behooves the rest of us who can get the vaccine to protect the ones that can't, because then we stop the spread of the infection. That's that herd immunity concept.
Yep. And what is the first thing somebody needs to do if they think that they've been in contact or might have measles?
Isolate yourself right away.
Okay.
And then, like I said, it's a 3-week incubation period. So you really have those 3 weeks of risk. But if you're having any fevers or cough or think you might have the measles, you need to obviously telehealth your doctor right away so that they can check. And if you're not sure if you've had the vaccine, or if you're born between 1957 and 1968, they were using an older vaccine that's not as effective. come from another country, you may not know if you got the vaccine. It's really easy blood test. So you can just call up your doctor right now and say, could you check my MMR titers,
Yes.
which is antibodies. They check it. And if for any reason it's low, you can always go out and get a booster to protect yourself.
All right. Be careful. Measles, it has officially come to Colorado. Yeah. Hopefully something that we will not see spread. Like it is possible to spread. So be safe.